Welcome back to Insight. We're here with Dr. Chang. We've been talking about the long-term effects and those long haulers, people who can't quite get over the COVID, dealing with those long-term effects like headaches and brain fog, as I can't come up with the word brain fog. I haven't even had COVID and I still am dealing with the long-term effects. All of those things that we just don't know what we're dealing with. You guys have come up with this long-term COVID clinic at Parkview. Tell me a little bit about the clinic.
Because of the symptoms are so widespread and so diverse, and we have a team of experts. We have physical medicine, rehabilitation doctors, providers. We have physical therapists, occupational therapists, speech therapists, neuropsychologists, neurologists. All the medical specialties available because of, again, involvement of the multiple organ systems and multiple symptoms. So not something just more ordinary, perhaps relates to respiratory, relates to the heart. It could be related to new diagnosis of diabetes or worsening diabetes. Could be sleep problems, could be anxiety, depression, and neurological conditions, as we talked about.
All those modalities working together
Right.
are going to perhaps help somebody, first of all, diagnose what it is that's exactly that's causing the problem, but then get to the bottom of fixing it.
Yeah, because the key, the first step, is to make sure there's nothing else. Because the person may have a heart condition, may have a neurological condition separate from the COVID, maybe have something else. So that's the first step, is indeed to make sure that this relates to the COVID, post-COVID, it's not due to something else. So that's the first step.
Right.
With that understanding, then we can start to look at individual symptoms we talked about, because symptom we can treat. We don't have a treatment medication for the post-COVID, but we can treat headache. We can work on brain fog. Our goal is to return the patient, a person, back to the pre-COVID, the level of function and the well-being.
How do we get to this clinic? What are the logistics of coming to the clinic?
At this point, we actually opened right about 6 weeks at this point.
It's brand new.
It's brand new. And so far, we work from, it's completely referral the clinic, and referred by Parkview Physician Group providers. A part of that is because of this care takes a comprehensive longitudinal care. And so we need partners that we can work together. We'd like to expand, but so far we're really swamped.
Oh, sure, I'm sure,
already.
Absolutely.
And so feel really bad, and we'd like to see more people every week. We're expanding the people that we can help, and for that reason.
Well, there's just such a need. We keep, I mean, that's all we hear about is how many people are having, that are long haulers. You know, that's kind of the term that gets used. Now, you're collaborating with the IU School of Health as well, right?
School of Medicine.
School of Medicine to help you all, correct?
Right.
Tell me about this collaboration.
Yeah. So, IU School of Medicine has a campus in Fort Wayne since 1981. And we have 4 years of medical students. 3 years ago, IPFW, as you may have remembers that, separate into Purdue Fort Wayne and IU Fort Wayne. So we're part of IU Fort Wayne campus. We have nursing, we have social work, we have allied dentistry, and public health, and the health and human sciences. And all this together, imagine that this is exactly what we do. It's a multidisciplinary team to take care of patients from that standpoint. So we can train students to know how to work together, research together, because the IU School of Medicine in Fort Wayne, we have great neuroscientists and also immunologists can work with the data scientists at Parkview Neuro Center, and also the clinical expertise at Parkview Neuroscience Service Line. So this is really, in many ways, the key is to give our patient the best possible care.
Well, and that's a win-win because they're getting some training,
Right.
But you're also getting extra researchers, and yeah, that's definitely a win-win. Where do you just see the clinic growing as we move forward post-pandemic? I'm knocking on wood that we're going to continue post-pandemic.
Yeah, unfortunately, we're still at a stage that we have to be very careful about more COVID. And as we mentioned, we don't have medication for post-COVID. The best way to treat the symptom is to prevent.
Right.
And the best prevention is vaccination.
Get your shots.
So for us, for our family, for our community, really, I just want to say to everyone to make sure you get vaccination, because that's the only way we can try to prevent this dreadful condition to spread in the community.
Yeah, that's the way to keep us from having to have more clinics and to go back to wearing masks all the time.
Yeah,
and
we would really like the clinic to be there's no patient coming.
Yes. That would be a perfect world, wouldn't it?
Right.
To not have a need for it. Well, we appreciate the clinic being there, though, to help us as we do have a need right now. We appreciate what you're doing. Right. We're going to talk about what's trending at aging and in-home services coming up next with Megan. We'll be right back.